International medical graduates face a transformed UK medical recruitment landscape in 2025, marked by significant recent policy changes, and an NHS desperate for doctors yet requiring substantial upfront investment and patience from overseas applicants. The UK National Health Service needs international doctors more than ever, with over 10,000 medical vacancies and 32 to 41% of the current medical workforce trained overseas. However, aspiring international medical graduates must understand substantial recent policy shifts, including increased visa costs, salary threshold changes, and a completely redesigned foundation allocation system that removes all academic scoring. This represents both opportunity and challenge. While the NHS actively recruits internationally, the personal investment required approaches £4,000 to £8,000 and may require 1 to 2 years of preparation before starting work. Let's look first at the costs, then at the examinations required. The UK government implemented sweeping immigration reforms on April 4, 2024, fundamentally changing the financial and eligibility landscape for international medical graduates. These changes directly affect every IMG applying to work in the NHS. Salary thresholds increased significantly. The health and care worker visa, the primary route for doctors, now requires a minimum salary of £25,000 annually. This is actually lower than the £38,700 limit for the general skilled worker visa, only relevant to those not applying via the healthcare route. Foundation programme doctors typically earn £32,000 to £40,000, comfortably meeting these thresholds, but the change signals the UK's shift toward higher paid immigration. Visa costs escalated dramatically, while the immigration health surcharge, paid by most visa applicants to access NHS services, jumped 66% from £624 to £1,035 per person annually. For a 3-year visa, this totals £3,105. Doctors receive an exemption. This exemption makes the healthcare visa route much more affordable than standard skilled worker pathways. Certificate of sponsorship fees nearly doubled in 2025. The certificate of sponsorship, the electronic reference number employers must provide for visa applications, increased from £239 to £525. While NHS trusts typically cover this cost, the increase reflects broader governmental pressure on immigration sponsorship. The sponsorship process itself requires international doctors to submit extensive documentation, including criminal record certificates, employment references covering 3 years, and proof of GMC registration. NHS England's National Overseas Sponsorship Team processes these applications, usually issuing the certificate within 48 hours of approval, though allowing 2 to 3 weeks for complete processing remains prudent. Now let's look at the recent changes to the examination landscape. GMC registration and PLAB examinations now align with medical licensing assessment. The General Medical Council transformed its licensing examinations in 2024 to align with the new medical licensing assessment framework, affecting all international medical graduates seeking registration. PLAB became MLA compliant in mid-2024. PLAB 1 became MLA compliant from August 8, 2024, while PLAB 2, one could argue that the new system dramatically benefits international graduates. Under the old academic scoring system, IMGs typically scored lower than UK graduates, particularly on the educational performance measure, which favoured UK medical school achievements. The PIA system levels the playing field completely. Success now depends entirely on preference choices and random ranking. This philosophical shift recognizes that academic performance during medical school poorly predicts foundation program performance and creates opportunities for IMGs who excel clinically but lack prestigious medical school pedigrees. Competition varies dramatically by location. For UKFP 2025, the overall statistics show 84% of applicants received their first-choice foundation school. However, this masks substantial geographical variation. London remains the most competitive foundation school, with 2,200 applicants competing for 1,238 posts. North West England follows with 1,437 applicants for 1,062 posts. In contrast, East of England had only 580 applicants for 898 posts, and Leicestershire, Northamptonshire, and Rutland had 227 applicants for 317 posts. 11 foundation schools had competition ratios under 1, meaning everyone ranking them first was allocated there. This is good news for strategic applicants willing to work outside London, who will substantially increase their allocation chances. Application timeline requires year advance planning. For the UK Foundation Programme 2025, eligibility applications open July 3 to 23, 2024, with outcomes in August 2024. Main applications occurred September 25 to October 9, 2024. This year in advance system means IMGs must complete PLAB examinations and GMC registration significantly before the intended start date. Missing application windows by even a day results in waiting a full additional year. No late applications are accepted under any circumstances. Eligibility requirements are strict. International medical graduates must obtain GMC provisional registration, demonstrate English language proficiency at IELTS 7.5 overall, and complete a mandatory clinical assessment if they qualified more than 1 year before the foundation program start date. From 2025, only IELTS academic and UKVI academic are accepted. IELTS general training is no longer valid. The removal of the Dean's statement requirement from 2025 simplifies documentation, but applicants must now submit medical degree certificates directly. So what about the general context in which the NHS is operating? The NHS faces critical workforce shortages despite record recruitment. The National Health Service confronts a paradox. Despite record numbers of doctors joining, vacancies persist and grow, creating urgent demand for international medical graduates while revealing systemic challenges in workforce planning and retention. Medical vacancies exceed 10,000 positions. As of March 2024, the NHS reported 10,165 full-time equivalent secondary care medical vacancies, representing 6.2% of all medical posts. Total NHS vacancies reached 112,840. NHS history, with explicit goals to reduce reliance on international recruitment through massive expansion of domestic training. Medical school places will double by 2031-2032. The plan commits to expanding annual medical school places from 7,500 to 15,000, with up to 15 new medical schools opening. GP training places will increase 50% to 6,000 by 2031-32. Medical degree apprenticeships will grow from 200 places in 2024-25 to 2,000 by 2031-32, creating alternative entry pathways. The plan also mandates foundation doctors complete 4-month rotations in general practice, addressing chronic GP shortages. An additional 2,000 plus specialty training places were completed by September 2024, with 1,000 more targeted to shortage areas. Workforce must grow 65 to 72% to meet demand. Current NHS staffing of 1.4 million full-time equivalent workers must reach 2.3 to 2.4 million by 2036-37, an increase of 900,000 plus staff. This means 1 in 11 workers in England will work for the NHS compared to 1 in 17 currently. Mental health, primary, and community care staff must grow 73% to address historic underinvestment. Nursing associate numbers will increase from 4,600 in 2023 to 64,000 plus by 2036-37. Physician assistant positions may increase to 10,000, but there is significant current controversy about the role, which was recently renamed from physician associate. Adult nurse training places have increased over 90%, mental health nurse places 93%. International recruitment will fall from 24% to 9 to 10.5%. The plan explicitly aims to reduce international recruitment's share from the current 24% to 9.0 to 10.5% by 2036-37. This represents a fundamental strategic shift. The NHS acknowledges current international dependency is unsustainable and ethically problematic, given recruitment from countries facing their own healthcare workforce crises. However, this reduction timeline suggests international recruitment remains essential for the next decade. Even reaching the 9 to 10.5% target means thousands of international doctors joining annually, just a smaller proportion of a much larger total workforce. Implementation faces significant challenges. The National Audit Office assessed the workforce plan in 2024 and identified significant weaknesses in modelling, noting some assumptions may be optimistic. Insufficient educator capacity exists to train increased student numbers. The leaky training pipeline means only 3 of every 5 nursing places result in working NHS nurses due to high student attrition. Capital investment in buildings, equipment, and technology required for productivity gains remains inadequately specified. Achieving the ambitious targets requires simultaneously increasing recruitment, dramatically improving retention, and reforming working practices, a challenging combination. A refreshed plan arrived in summer 2025. The government introduced a refreshed workforce plan in summer 2025, focusing on 3 big shifts: hospital to community, analog to digital, and sickness to prevention. This plan aligns with the 10-year health plan due spring 2025 and be revised every 2 years going forward, responding to Lord Dar's findings on NHS underinvestment and lack of community resources. International medical graduates face a complex, lengthy, and expensive journey from deciding to pursue UK practice to beginning foundation program work, requiring careful planning and realistic expectations. Total timeline spans 12 to 24 months minimum. The realistic pathway begins with PLAB preparation, English language testing, GMC registration application, foundation program eligibility application, and main application. For example, to start foundation program in August 2026, applicants should begin PLAB preparation no later than mid-2024 and apply to the foundation program in July-September 2025. Critical deadlines include completing PLAB 1 by November of the year before starting and PLAB 2 by May to allow GMC registration processing time. Financial costs range from £4,000 to over £8,000 before earning income. The minimum pathway for someone choosing the health and care worker visa and passing examinations first time includes PLAB 1, PLAB 2, English language test, GMC application, document verification, health and care visa for 3 years, and travel and accommodation for PLAB 2 in Manchester, totaling £3,066 to £466. Those requiring the general skilled worker visa face an additional £3,105 immigration health surcharge plus higher visa fees, bringing the total to £6,940 to £8,040. These figures assume first-time examination passes. With up to 4 attempts allowed for each PLAB component, costs can escalate. International graduates who succeed typically begin preparation 18 to 24 months before intended start dates, pass PLAB examinations first time, and complete at least 1 Royal College examination Part 1 before job applications. This single factor proves the biggest differentiator in securing positions. Using recruitment agencies alongside direct applications increases success rate substantially. Joining the BMA immediately provides essential support and representation. Choosing non-training resident grade roles for initial NHS employment provides structured support while building experience. Strategic applicants apply broadly to multiple locations and specialties initially, accepting less popular regions to gain NHS experience. Building professional networks through IMG social media groups, trust activities, and specialty societies provides crucial peer support. Maintaining resilience through inevitable setbacks and rejection proves essential. The process is challenging, but thousands of IMGs successfully navigate it annually. Strategic considerations for prospective applicants. While the foundation program provides structured 2-year training ideal for recent graduates, international doctors should understand alternatives exist. Trust grade positions, locally employed doctor roles, and specialty training direct entry offer viable routes. Many successful IMGs work 1 to 2 years in non-training posts to build NHS experience, obtain UK references, and strengthen applications before pursuing formal training pathways. This approach often proves more successful than immediately targeting competitive foundation program places. Geographic flexibility dramatically improves prospects. London's 1.78 competition ratio means fewer than 57% of applicants listing it first will receive allocation. East of England's 0.65 ratio means 100% of first preference applicants received offers with spaces remaining. For applicants primarily focused on working in the NHS rather than specific location, choosing less competitive regions provides near-certain allocation. After completing foundation program, opportunities exist to move to preferred locations for specialty training. Financial planning requires realistic assessment. Beyond official fees, applicants should budget for accommodation during PLAB 2 travel, potential examination retakes, professional indemnity insurance, relocation to the UK, housing deposits, and living expenses during the gap between arrival and receiving first salary. Some NHS trusts offer relocation packages or fee reimbursement. These are negotiable and worth requesting during job offer discussions. Visa route choice significantly impacts costs. The difference between health and care worker visa and general skilled worker visa exceeds £3,000. Foundation program doctors should qualify for health and care worker visa, but understanding eligibility criteria and ensuring correct application prevents costly mistakes. The health and care route also offers faster processing and pathway to settlement. The NHS needs you, but demands patience. Despite critical workforce shortages and ambitious recruitment targets, the system requires international graduates to navigate complex bureaucracy, substantial financial investment, and lengthy timelines. Government workforce plans acknowledge international recruitment must continue for at least the next decade while domestic training capacity grows. For international medical graduates willing to invest time, money, and emotional energy in the process, genuine opportunities exist to build careers in one of the world's largest healthcare systems. The key is entering with realistic expectations, adequate financial resources, strong support networks, and strategic planning. So what is the conclusion here? The landscape for international medical graduates applying to UK Foundation Programme reflects both expanded opportunity and increased complexity. The introduction of preference-informed allocation creates unprecedented equality between international and domestic graduates in foundation program allocation, representing a philosophical shift away from academic elitism toward geographic preference optimization. However, this positive development occurs alongside substantial cost increases. Immigration health surcharge rose 66%, certificate of sponsorship fees more than doubled, and examination fees increased, creating significant financial barriers despite the NHS's desperate need for doctors. The UK faces a stark reality. With 40,000 fewer doctors than needed to reach OECD averages, vacancies exceeding 10,000, and approximately 50% of new graduates leaving annually, international medical graduates provide essential workforce capacity without which the NHS would not be able to function. The government's long-term workforce plan aims to reduce international recruitment from 24% to 9 to 10.5% by 2036-37, but this timeline confirms international doctors remain critical to NHS operations for at least the next decade. For prospective IMG applicants, success requires strategic planning beginning 18 to 24 months before intended start. Financial resources of £4,000 to over £8,000, willingness to work in less competitive regions, and realistic expectations about challenges including discrimination, cultural adjustment, and difficulty securing first positions. However, with 84% of foundation program applicants receiving first-choice allocations under the new system, regional variations creating near-certain placement in less competitive areas, and extensive support infrastructure developing through BMA, NHS England, and trust-based IMG offices, the pathway remains viable for thousands of international graduates annually. The fundamental truth is that the NHS needs international medical graduates as much as international medical graduates seek NHS opportunities. Navigating the 2025 requirements successfully requires understanding recent policy changes, strategic application choices, comprehensive financial planning, and resilience through a complex bureaucratic process. But for those who persist, genuine career opportunities await in a healthcare system employing over 1.4 million staff and growing toward 2.4 million by 2036.